Hi everyone, welcome to Spine Time with Dr. Michael Horowitz, a Vancouver chiropractor out of the Hycroft Medical Building at Granville St. Hi Dr. Michael, how are you doing today?
Great, thanks Rachel. How are you?
Good, thanks.
Awesome.
So today our Spine Time topic would be herniated discs.
Yes.
So is there a difference between, let's say, herniated disc, bulging disc, or even slipped disc?
Right, okay, good question. Reality is a disc can't really slip. But think of the spine. The spine's made up of 24 vertebrae. Between each vertebrae is a disc. Within that disc is a soft gel-like material. And when there's an injury that affects the disc, it can create a full herniation or a bulging disc. Typically that'll happen to the side or to the posterior or back side of the spine, and it can actually be quite painful. When patients come in with this type of symptom, it's not your typical low back pain. It's usually a high degree of pain. There's a lot of muscle spasm around the spine. Typically there's inflammation and chemical irritation as well as physical irritation to the nerve itself. And it may be associated with pain down the leg, sciatic type pain, but it's not your typical low back pain. It definitely needs special attention.
So what are the first symptoms?
Typically a lot of difficulty, especially flexing forward, bending over to tie your shoes or to touch your toes. It also tends to be when you're sitting down on a couch or on a chair, you may start to feel a sensation of cramping or achiness into your glutes, into your leg, or even down to your foot as well. It's usually acute and very painful with limited mobility and motion. And that's one of its differentiating causes to just regular, typical low back pain.
Thank you so much for this great information, Dr. Michael.
Okay, my pleasure.
So if you guys have any more questions on herniated disc, you can always call the office or look at the website.